All right. So when you're doing a knee evaluation, you're going to want to do some observations first. You're going to take a look and see if there's any swelling, any bruising, ecchymosis, any sort of edema that might be going on, any sort of bony abnormalities. Then you're going to want to have your athlete just take some steps and see if there's any change in their gait. If you notice any limp or any other changes in how they're walking. This is something that you can observe the Ottawa knee rules as well. Those are indications that you're going to want to give somebody a referral for X-rays after a knee injury. One of those is if your athlete or your patient is over 55 years old, if they can't take 4 steps immediately after injury or at the evaluation, if they have isolated pain at their kneecap or at the head of the fibula, or if they can't bend their knee to 90 degrees. So any of those indications, you're going to want to refer for an X-ray. Okay, so then you're going to want to move on to palpations. Again, you're going to want to palpate with a purpose. We're going to be looking for any pain, any swelling, ecchymosis. We're going to be feeling around for any sort of bony deformities. One thing you're going to want to look, you are going to want to go up the thigh too and palpate the IT band as it does insert at the pes anserine. Or sorry, Gertie's tubercle. So as you're palpating, you're going to want to palpate the tibial tuberosity. This is where patellar tendon inserts. Any pain below the patella at the patellar tendon is an indication of Osgood-Schlatter's. Usually you're going to see that in a lot of younger adolescent athletes. In the middle of the patella, that could be an indication of Sinning-Larsson-Johansson's disease. And just above the patellar tendon, or just above the patella rather, if there's pain up here, that could be an indication of bursitis. Moving along, you're going to want to palpate right at the joint line as well. If your athlete has pain medial or lateral at the joint line, this could be an indication of meniscal tear, some sort of meniscal damage. You're also going to want to palpate right at the fibular head, just up here, and at the LCL. You're going to feel the LCL right through here. It's very easy to find it if you have your athlete cross their legs. So put your ankle up to your knee. And if you get lucky, it'll pop out, but it's very thick, almost like a pencil on the lateral side of their knee. And medially, you want to palpate for the MCL. That's going to come down right into the pes anserine, and it's going to start up at just the medial fibular head, or femoral head as well. Okay, and another thing you're going to want to do as well is palpate the popliteal fossa. Sometimes this is overlooked. But you're going to palpate just behind the knee for any pain, swelling, any sort of point tenderness back there as well. Okay, so then we're going to want to move on to range of motion. So first you're going to have your athlete do active range of motion, flexion and extension, see what they can do on their own. All right, you're looking pretty good. Then you want to move on to passive range of motion and see if there's any sort of hard stops or soft stops during the range of motion. And then you're going to want to do resistive range of motion and just have them go through their active range of motion and just apply a little bit of extra pressure for resistance. So extend up. All right, and flexion. Okay, so for some manual muscle tests too, it's going to be a lot of the similar things from the ankle. You're just going to want to hold them in a position, have them in knee flexion here. You're going to hold them in flexion, and you're going to tell them not to break them out of this position. So hold this position tight. Okay, we can do the reverse for extension manual muscle test. All right, good. Okay, so then we can move on to special testing. First thing we can do is test some ACL special tests. First one we can do is Lockman's test. So you're going to have the athlete bend their knee to about 20 degrees. You're going to stabilize just above the patella, and you're going to apply anterior force with your thumb right on the tibial tuberosity. So if you see any laxity in the ACL, if you see the tibia coming forward a lot, that's going to be strong indication of an ACL tear. Another ACL test you can do is anterior drawer. So you can have the athlete keep their leg at about 90 degrees, have their foot kind of stable on the ground. You're going to get your hands right behind their kneecap, and you're just going to apply another anterior force. And again, you're looking for that tibia to come forward, and that's an indication of some laxity in the ACL. All right, lay down. All right, so a couple of tests for the PCL. One is a posterior drawer test. You can have the athlete put the leg at 90 degrees, and it's very similar to the anterior drawer test. You're just going to have your hands in the same place as you did with the anterior drawer test, but you're going to apply a posterior force. So you're looking for any sort of posterior movement that's going to express PCL laxity. Another test is the sag test. So while the athlete has their leg in a 90 degrees, you're going to be looking for a slight sag in the tibia. So indication of any PCL damage, you'll see sag in the tibia just below the patella. And it just looks like an indentation as the rest of the leg just sags posteriorly. All right, so moving on to some meniscus testing. One of the tests you can do to look for any sort of meniscal tear is McMurray's test. So with McMurray's, have the athlete keep their leg straight, and you're going to move them into 90 degrees while applying varus and valgus forces. And this should give them some sort of a clunking or some pain while you're doing this, and that can be an indication of a meniscal tear. Another test that you can do is you can just test a joint line. I already forgot what I was going to say.